Hi, I'm Dr. Cleeman, and this is a video, and I'm going to be talking to you a little bit today about rotator cuff tears. And the rotator cuff tear I'm going to be talking to you about today is partial rotator cuff tears. There's a difference. There's different kinds. There's the full thickness rotator cuff tears, and then there's partial rotator cuff tears. And today we will just touch upon partial rotator cuff tears, what that means, what it looks like, how we operate on them, and what the recovery is like. I hope you like this video. Please let us know what your thoughts. We've discussed anatomy in previous video, so I'm just going to do a quick review just for those of you who may not have seen the other video. So we're going to talk about the anatomy in the shoulder and just the highlights here. So what we're looking at is a little diagram that I put together, and I think it's very helpful to have a diagram. It just makes it easier to understand. So the rotator cuff muscles are a group of 4 muscles that surround the shoulder, the ball of the humerus, which is the ball and socket of the joint, and these are shown in the red. And the rotator cuff muscles, like any muscle, turns into a tendon, which is sort of gray and thick and strong, and that's what attaches to the bone. So here we're showing 2 of the rotator cuff muscle tendon units as they're attaching to the ball in the shoulder. Now there's also something called the bursa. The bursa is a little fluid sac, kind of like a balloon if you will, and it helps things glide a little easier, and we have them all over our body by all of our joints. So what is a partial rotator cuff tear? So what it really is a fraying, if you will, like at the end of a rope where it gets frayed. And we see the same thing with the tendon. It can become frayed and partially torn, and it usually happens on the undersurface of the tendon. So there are 2 sides, the undersurface and the top side. And these partial tears are usually on the undersurface. Now this is different than a full thickness tear. In this diagram you could see would represent a full thickness tear where the tendon has completely pulled off the bone and retracted, but that's something for another video at another time. So again, we'll just show back up here the partial rotator cuff. It's a fraying like at the end of the rope, and those fragments can catch in the joint and cause pain. In this clip, we're looking inside the joint. Here you see the biceps tendon, and then there's the sheet of the rotator cuff inserting onto the ball of the humerus, the ball and shoulder. And this is an intra-articular view. Here, I've written it down. You can see where the rotator cuff tendon is, and where the biceps tendon is, and where the humeral head is. Okay, so here we're looking at a patient who has a partial rotator cuff tear, and you can see those torn fragments that are catching inside his joint. And that's a shaver that we put in that has a suction, and we're able to debride out, meaning remove and get rid of those fragments that are catching inside the shoulder and causing pain. And we remove all those torn fragments back to a smooth, stable border that doesn't leave any edges that can catch and cause the pain in the patient. Hi, it's Dr. Cleeman again. Post-op, what can we expect? Well, first let's start from the beginning. When you have surgery, these type of procedures for a partial rotator cuff are usually what we call ambulatory, which mean that you're going to come in and go home the same day. And that's nice because no one really wants to have to stay in the hospital if you don't have to. So how do we achieve that? How can we get you home the same day? So typically patients will have a type of anesthesia that we call regional anesthesia, which is basically they get an injection, what we call an interscalene block, and it numbs up the shoulder and arm, and that usually lasts for several hours, which is great because you go home and you don't have pain. Eventually the block does wear off after several hours, and then there will be pain. We usually recommend for our patients, start taking your pain medication before the pain sets in. It's easier to stay ahead of the pain, and we find that seems to help. The other thing that we have found that sleeping has been a complaint that patients often have, that they have more pain at night when they sleep. Trying to find a more comfortable position is always helpful. Sleeping on that shoulder we do not recommend, and that certainly would aggravate the pain. And any type of sleeping we've heard has been problematic. One thing many of our patients have found that has been helpful is to get what's called a wedge or a bunch of pillows, and that will help prop you up into a more seated type of position, and that seems to help decrease the pain. After surgery, we often have the use of a sling, and the sling helps with comfort, which is different here when we have a partial rotator cuff that we are cleaning out and debriding, as we saw in the video beforehand. So there's no healing of a tendon that we need to wait, like in a full thickness tear. So it's just about comfort, and usually patients will get rid of the sling after a day or so, just when their pain eases up a little bit. One of the other things that we have found very helpful in reducing pain is one of these ice compression type of machines and devices, and it gives a little compression, and the ice really help to get rid of a lot of that pain, and we found that to be very effective. In terms of recovery, we get that question. It's understandable. You want to know how soon you're going to get back to your life and your sports and things like that. It's obviously different from patient to patient, and genetics play into that, and what you do and those type of things. But we would say in general about 2 to 3 months would be about normal recovery for this type of a procedure. Of course, each person is different, and we would recommend you speak with your orthopedic surgeon about your specific scenario and case, and if there are any specific questions. Thank you for watching this video. Have a great day.